3 months before I operated on him, Ramesh, a 58-year-old diabetic, walked into a local clinic with a small wound on his toe that wasn't healing. He was told, "Dawa lagao, dressing karo, theek ho jayega. Apply some cream, it will heal." But it didn't. By the time he reached my operating table, his foot was cold. The skin had started turning dark and black, and the blockage in his leg arteries was so severe, we were genuinely discussing whether the leg could be saved at all. And here is what should stay with you. This did not happen overnight. His body had been warning him for years. He just didn't know what to look for. So today I want to change that for you or for someone in your family. Ramesh was a man who thought he was managing okay. Diabetic for over 10 years, on his medication, watching his food, more or less. He was active, he went for his morning walks. But somewhere around 5 to 6 years ago, he started noticing something small. After walking for maybe 200 or 300 meters, his calf would cramp upon, tighten, like the leg was suddenly running out of energy mid-walk. And then he would stop, rest for a few minutes, and his pain would go away completely. So he adapted. He started walking more slowly, taking more breaks, and because the pain went away every single time he stopped, he told, "Umar ke saath to ye hoga hi thodi kamzori hogi." But this is the trap, and this is the most dangerous part of the whole story. Because let me tell you something right now that most of you seeing this video do not know. Pain in your calf muscle that comes during walking and completely goes away when you rest, that is not weakness, that is not age. That is your leg muscles screaming for oxygen and blood and not getting it. Your arteries are supposed to deliver oxygen-rich blood to your muscles as you walk. When they are narrowed by disease, blood cannot go there fast enough. So these muscles run out of fuel. And when you stop, the demand drops and the pain settles. This has a medical name called as intermittent claudication. And it is one of the earliest, clearest warning signs that your leg arteries have started to block. Most people miss it completely because the body is quietly adapting while the damage grows inside. For Ramesh, things slowly got worse over the next 2 years. First, the foot started feeling colder than the other one, almost all the time, not sometimes, but constantly. Then, the pain stopped waiting for him to walk. It started waking him up at night. He would get up and hang his leg on the side of the bed to get some relief. That is actually a classic pattern. When blood flow becomes so poor that even lying flat isn't enough, gravity helps a little when the leg hangs down. Patients instinctively do this without even understanding why. And then came the wound, a small blister near his toe from a tight chappal. He had put some ointment, he had tried some home remedies, he even took antibiotics from the local medical shop. 2 months passed. Thoda theek hota hai, fir wapas aata hai. It just wouldn't heal. Now here is something I want you to really understand. People think wounds heal because of a cream or medicine or dressing. The real reason a wound heals is blood flow. Oxygen-rich blood carries the healing cells, the nutrients, the infection-fighting components. All of that travels through your arteries and reaches the damaged tissues. When the blood supply is blocked, none of those things arrive to that wound. The wound just sits there. It looks like it's healing. Then it opens again. Over time, with poor circulation and infection together, the tissue starts dying. That is not dramatic language. This is exactly what happens at a cellular level. And in a diabetic patient, it happens faster, much faster. When Ramesh finally came to us, we ran a proper vascular scan. The results were alarming, and I have seen a lot of these scans. Multiple arteries supplying the leg severely narrowed. Blood flow below the knee had reduced to a fraction of what it should be. The muscles, the skin, the nerves in the foot were surviving on whatever tiny amount of blood could squeeze through those arteries. I showed him the images. He went quiet for a moment. Then he said, "Itna serious hai? मुझे पता ही नहीं था. I hear that in my OPD more often than I would like to admit, because artery disease doesn't send a dramatic signal. It doesn't announce itself. Plaque builds up slowly over years and decades because of diabetes, smoking, high blood pressure, high cholesterol, all which lead to slow narrowing of the passage, slowly reducing the flow. And by the time the symptoms become impossible to ignore, the damage inside is often already quite advanced. Now here is where diabetes made everything significantly more dangerous, and I cannot stress this enough. Diabetes damages blood vessels, that's one problem, but diabetes also damages nerves. So if you have a patient who has poor circulation and reduced sensation in the feet, this combination is genuinely dangerous, because now the patient may not even feel a wound forming. A tight shoe, a small cut, a crack in the dry skin of the heel, they walk on it for days without realizing anything serious is happening. And by the time they feel it, or most usually they see it, the damage has already deepened. That's why I tell every single diabetic patient, check your feet every day, look at the soles, look between your toes. Do not rely on pain to warn you. With diabetes, pain is an unreliable messenger. For Ramesh, the decision had to be made quickly. The circulation had to be restored. There was no way going forward. And without improving blood flow, no wound dressing, no antibiotic, no cream would make a real difference. The tissues were simply not getting enough of blood which they needed to survive. Depending on where the blockage is and how severe, we have different options. Sometimes it's a balloon angioplasty in a stent. We insert a thin pipe or a tube through a small puncture in the groin and advance it to the blockage, inflate a tiny balloon to open up the narrowed artery, and place a stent to keep it open. In more severe or advanced cases, we do something like a bypass. Yes, a bypass for the leg arteries, where it's a whole new channel which is created using either the patient's own vein or an artificial graft. In Ramesh's case, the blockage was quite severe. We had to do an angioplasty with a bypass, and I still remember what happened after that. After surgery, the color slowly changed, the coldness began to go away, and he told us the next day morning after surgery. For the first time in the last few months, he had slept through the night without the leg waking him up. The wound, the same wound that had not changed in 2 months, showed its first real signs of healing within the first 2 weeks of restored blood flow. That moment, that exact moment is why I became a vascular surgeon. But here is what I need you to understand clearly, and this is the part most patients don't hear. The surgery is not the cure. The surgery is a second chance. If nothing changes after that, the same uncontrolled diabetes, the same smoking, the same diet, the arteries can block again. Different ones or even the same ones. So protecting your circulation after surgery or before things even get that serious requires consistent, honest effort. Blood sugar control becomes absolutely non-negotiable. Every spike in blood sugar causes further damage to already fragile blood vessels. Not sometimes, every time. Smoking, if you smoke, you must stop it completely. It is possibly the single most damaging thing for circulation. There is no gradually cut down on it. It needs to stop completely. Blood pressure, cholesterol levels also need to be properly treated. Your doctors will guide you, but don't take it partially. Take it seriously. Walking, which had become painful for Ramesh, now became one of the most important medicines for him. In many people, we've seen that regular controlled walking actually stimulates the development of new blood vessels over time. These are nature's own little bypasses in some way. And if you have diabetes and you are over 50, please get a vascular assessment once a year. Don't wait for a wound. Don't wait for the nighttime pain. Ask to be checked before things reach that stage. If you want a very concise checklist to check your circulation, do click on the link in the description. You may save it and share it with your friends and relatives who will benefit from it. Coming back to Ramesh, his leg was saved. He walks now more carefully, more mindfully than before, but he walks. He is alive, he is well, and he has a second chance that not every patient gets. Because some patients come too late to us. Some wait till all their toes have turned completely black, and by then the options have become very limited. So a message for all of you seeing this video. If anyone you know, a relative, a friend has any signs of peripheral arterial disease, you must go and consult a vascular surgeon and try to identify the problem early, because the earlier we identify, the better it is to treat them. I hope you like this video. Do subscribe to the channel and you may find this video equally interesting.